Welcome back to day 2 of Eyes on Dry Eye 2023. I'm your co-moderator in the exhibit hall track, Dr. Damon Durker, coming to you live from Eye Surgeons of Indiana in Indianapolis. Our next session is called Seize the Daily, making daily eye care part of daily self-care and monetizing it for your practice. I'd like to introduce Dr. Lisa Hornick and Dr. Edmund Farris. Lisa, welcome to Eyes on Dry Eye. I hope you're enjoying the show. You want to tell everybody a little bit about yourself and your practice, and I'll let you guys tell us more about all things that are MISE.
Awesome. Thank you so much, Damon. And absolutely, I always enjoy Eyes on Dry Eye. This is such a phenomenal conference. And again, my name is Dr. Lisa Hornick. I'm joined here today with Dr. Edmund Farris, and I practice in private practice in Rockland, California, which is right outside of Sacramento. And we have a specialty dry eye practice there. So we're very focused. We're very passionate about dry eye. And I'm really excited today to talk to you about MISE. And our motto here at MISE is Seize the Daily. And what that means is we want to make daily eye care part of daily self-care and help that to monetize your practice. So that's what we're going to talk about today. So what this is all about. Well, we know that the burden of dry eye is escalating daily. We also know that patients are probably being unmet with their needs and underserved. Eye care providers are also being unmet and underserved. And what we mean by that is, you know, we've all had that patient in our practice where you have them, we diagnose them with dry eye, we give them this really great treatment plan, and we say, you know what, Mrs. Jones, let's see you back in 1 month or 3 months and see how you're doing. So they come back in and they say, you know what, doc, my eyes, they're just not feeling any better. I still have all these symptoms and problems. And it causes a little bit of frustration and confusion because we say, well, okay, talk to me about, you know, your treatment plan. Were you able to do all the things that I suggested? And we all know a lot of times their at-home compliance is just not that great. So they'll say, you know, I did that for a little while, a couple of weeks, but then it just got too complicated. It got too confusing. I didn't know where to go to get the products that you recommended. So I just stopped. And it causes this increased frustration because our dry eye patients are just not improving the way that we want them to. So we have new tools with MISE that are going to help you with that. In the next 25 minutes, we're going to show you how both you as a provider and your patients are going to benefit from seeing this change on a daily basis. So first, let's talk about the dry eye market. Right now, there's about, well, in 2020, there was about $2.9 billion worth. In 2023, now the dry eye market is worth about $5 billion. And as you can see from this slide, that keeps growing and growing. It's estimated that in 2030, the dry eye market will be as big as $8.1 billion. And we all have seen this number before. We know that there's about 16 million patients that are diagnosed with dry eye, right? So that's our patient already in our chair, already on a treatment plan, excuse me. And, you know, they're doing okay with that treatment plan. But there's all these other patients. We think about 30 to 50 million patients total. So probably more than half our patients are undiagnosed with dry eye. So that's our other patient over here. And, you know, she works on a screen all day long. And then she moves to her phone. Her eyes itch, they burn. She has warm body sensation. Her eyes feel terrible at the end of the day. And, you know, she's confused. She doesn't know why, because she doesn't even know that she has dry eye disease. So this is something, it's becoming a major problem. Let's talk about the economic burden of dry eye. So keep in mind, these numbers are actually from a study from 2011. And the direct medical costs, in other words, what our patients are spending on their dry eye disease treatments, mild, about $678 per year, moderate, $771 per year, and are severe, over $1,200 per year on dry eye, you know, treatment and management. So indirect costs, in other words, loss of productivity. So what this means is, you know, the way our work performance or your patient's work performance is affected. So the mild and the moderate, around $12,000 per year in lost productivity. And your severe patients, even more, about $18,000. And again, these were 2011 numbers. So we can all assume that these numbers are probably significantly higher right now. So there is a tsunami of dry eye patients that are coming. And are you prepared for this tsunami? We at MISE want to make sure that you are prepared. We want to give you the tools that you need to take care of all these patients that are coming. And there's all different kinds of treatments for dry eye and causes for dry eye. We know that dry eye is multifactorial. So it could be your contact lens patient. It could be the cosmetics that your patients are using on their eyes. It could be all those gaming devices that are out there. So I have a 14-year-old. all you parents of teenagers, I know, I know you're in the same boat with me, that he just uses his Xbox way too long. Whenever he comes out of his room and he's been on there for a couple hours, his eyes are red and irritated. He has dry eyes. So we have our patients, our elderly patients that are ready for cataract surgery. We also have our younger patients now, our millennials, our Gen Zs, they're all complaining about dry eye because of increased screen time use. I have a first grader as well, and he actually has some symptoms of dry eye disease, and he's 7 years old. So it's kids as well. We have to think about all different ages. And he's not the only one in his class that complains about dry eyes because they're using devices so much at schools now. So there's definitely some unmet needs here. So what do our patients need? Well, we know that our patients are very individual. So in other words, one artificial tear, one lid hygiene product might work really great for one patient, but it's not going to work as well for another patient because there's different reasons why they have dry eye disease. So our patients need a daily personalized treatment plan, and they need to make that plan routine. The reason, and as we know, dry eye disease, there's no cure, and it is chronic and it is progressive. So if we don't do anything about it, it's going to continue to get worse and worse and worse. How about us as eye care providers? What do we need? Well, we're really busy. We have crazy busy practices, and dry eye disease patients, they take a lot of time to educate. We don't always have that time to educate, to tell them exactly what products that we recommend for them or where is the place to get them. So what MISE is going to do is create tools for you in digital healthcare platforms, and they're going to give you what you need. So certain products that we're going to recommend that you tailor to your specific patient, and we're going to give you a place that they can go in order to purchase these products. So you know that they're getting the correct product that they need for them to get better. And at the same time, Dr. Farris is going to talk about this in a little bit. It's going to help you to monetize dry eye disease in your practice. So again, think about everybody, every single patient who walks into your office as someone who might suffer from dry eye disease and blepharitis. So again, that device user, we're all on our devices too much these days. The contact lens wearer, the teenagers that are gaming, the airplane traveler, we're back up in the air, we're traveling again, and we know that can exacerbate dry eyes. Those who like to spend time in the cold weather, whether it's skiing, snowboarding, the RX user, our glaucoma patients, right? Our patients who are taking medication for their systemic diseases that then have the side effects of the dry eye. Again, we talked about millennials, Gen Zs, everybody. So think of what they need and what they need to use every single day. And that's how you can help them improve their symptoms. So we talk about the value of daily a lot. So daily is what differentiates us. As eye care providers, what we can do is change the mindset of our patients and make sure that their eye care is part of their daily routine. So we all have a skincare routine that we do every single day. We have a hair care routine that we do every day. We brush our teeth every single day. So we need to, again, shift that mindset, get our patients to understand that this is something that they need to take care of every single day. And why is that important? Well, because if they do it every single day, it becomes a habit. And when it becomes a habit, those behaviors are going to change. So Mrs. Jones is going to actually stay on the treatment plan that you prescribed for her because it's a habit, because it's her routine. Dry eye, blepharitis, they're daily health issues, and their eye health is also routine. So eye health needs a behavior change, and that daily eye care is the change. So really, really excited. Our charge is clear, seize the daily. So now I'm going to give it over to Dr. Farris, and he's going to talk about what MISE is exactly. He's going to talk about the purpose, the vision, and the mission, and the promise of MISE. So Dr. Farris, take it away.
Thanks, Lisa. Thanks for that wonderful presentation and for the great setup. Well, good morning to everyone. I'm Dr. Ed Farris, Chief Medical Officer of MISE. We are delighted to be here with you today. I would also like to thank those at Eyes on Eye Care for the opportunity to be here today and for their excellent two-day symposium on dry eye. I would like to present to you what we believe to be a compelling story to help you in your practices and to significantly improve the lives of your patients that suffer from dry eye and blepharitis. Dr. Hornick is controlling this slide deck, so you're going to hear me saying next every once in a while, so just so you're prepared for that. So who are we? What do we do and why do we exist? Mize is the only digital health platform focused exclusively on eye health. Our mission is simple. We want to make eye care part of everyone's daily self-care routine. As Dr. Hornick just said, we have routines for our skin, our hair, our teeth. We want them to be clean and healthy and to look their best. Why don't we do the same for our most precious sense, our eyes? Blindness happens to be the second most feared disease next to cancer. Yet in our everyday lives, we take our eyes for granted, and we don't do the simple things to take care of them, which is why Mize was born. We are Mize, the daily care for eyes. Next, Lisa. So how does Mize work for the doctor? Well, once you sign up for the platform, and it really only takes a few minutes, you'll receive a personalized QR code and web URL that attaches you to the Mize platform. Mize then interacts back with the doctors in order to keep them engaged. What Mize provides to the patients are simplified daily routines and products sourced from some of the best companies in the eye health space. The products are chosen by myself and our team and vetted by our world-class ophthalmic and optometric advisory boards. We provide simple access through your QR codes and dedicated web address. What we then do, which differentiates us greatly from anyone in the industry, is to provide ongoing support to the patient to assure compliance with the regimens you have recommended to them. So they keep coming back to us and then subsequently to you. Next. All of this occurs while we are capturing valuable data for the future. So what does the, go ahead, next. So what does the experience look like? Go ahead, next. As soon as you sign up to be a MizeCare partner, we will contact you to obtain a photo of you or your practice and set you up with your own dedicated virtual storefront, your kiosk in the cloud, if you will. All of this on the Mize platform. You can select from our prepackaged routines and other products what you would like to feature on your storefront based on your own personal preference. Next. We then create for you a personalized tear sheet with the curated prepackaged routines and the rest of the available products. This will contain your name, your own personalized QR code and web URL for ease of access and patient convenience. You just check off the products you wish the patients to purchase and use based on your examination, hand them the tear sheet, and that's it. They go onto the platform, select the products you highlighted, and if they have Shop Pay or Apple Pay, they're done. If you have the staff, this can all be done before they leave the lane, or certainly by the time they leave the office. Products are shipped to them and appear in the mailbox in 2 to 3 days. And all the products are really very competitively priced against any big box store. Next, please. Again, what differentiates us from the competitors is that we have an app in development that will allow us to track and monitor patient compliance, set goals, and deliver magical moments. Simple things like asking the patient how their eyes feel on a daily basis, what the temperature and humidity is in their area, or the pollen count. This will allow us to tell the doctor when they may be falling off of their regimen or need a follow-up visit. Next slide. You don't need extra space to source and stock product, worry about staff managing inventory and selling product, or have concern for loss of product or expiration dates. No need for multiple samples and coupons to clutter up your workspace and be difficult to find and present to the patient. Actually, you can throw them all out. I have. The tear sheets make it simple for anyone in the office to describe to the patient and convert quickly and easily, either in the lane, prior to leaving the office, or at home. And because these are their doctor's recommendations, patients are more likely to buy from the platform, especially when the codes lead them to a storefront with their doctor's information, not a large store they may or may not like and wish to engage with. And with all the post-COVID digital transformation, patients enjoy the convenience of a virtual store rather than traditional brick and mortar, especially the elderly who would rather have the products delivered to them to their home. Next, please. So that's the overview of how the platform works. Now, what's in it for the doctors? Next, please. First of all, there are absolutely no out-of-pocket costs. That's right, no cost to our partners, no hidden fees, no quotas to meet, no monthly minimums to achieve, no purchases of promotional materials, no beginning purchases or associated costs, and no space to give up in your office. Mize provides the entire service to you and your patients. Doctors participate in a model which offers retained revenue of 15 to 20% of the total order value. Next. The other benefits are when patients enter the site through social media or other means and don't have a doctor, we have the ability to direct them to partner doctors in their area. This is especially true for millennials and Gen Zs who often don't have an eye care provider. In addition, since doctors are engaged to look for signs and symptoms of dry eye and blepharitis, it makes us better doctors. When I walk into a lane, my first question is, how do your eyes feel? This often leads to a conversation about dryness, grittiness, irritation, tearing. This begins the conversation, which will ultimately lead to better outcomes for patients and happier doctors. Next. When we speak to our patients, we can educate them about the importance of daily eye care, healthier eyelids, meibomian glands, and a well-lubricated corneal surface. This helps the patient understand the disorder and instills trust in their provider. Next, please. The rest is related to the ease of use of the platform and the dedicated customer service Mize provides. This leads to a good experience for the patient, keeps them engaged to return for their next purchase. When we speak about the importance of a daily plan for preventative or supplementary care, the patients get it, and Mize provides it. Next, please. This is Mize Care. When you sign up for the platform, you become a Mize Care partner with all the benefits I just presented to you and really no risk. You can choose to use the platform as you wish, as much or as little as you want. But obviously it's in your best interest to use it a lot. Mize Care is also great for your patients. They love the products and customer services we provide. Personally, in my practice, most patients can benefit from something on the platform. Patients with simple dry eye, blepharitis, Demodex, meibomian gland dysfunction. We have products to address all of these and more. We will be rolling out specific allergy, Demodex, and blepharitis routines in the coming days and weeks. Contact lens patients especially require daily rewetting. I have my patients go to the site to get a 3-pack of preservative-free drops and use them daily. It's cost-effective for them, and I know they're using a quality product. And the drops that we recommend can be used with or without contact lenses, and all are preservative-free. Now, we offer only OTC products, but the right OTC products. We solve for the decision paralysis that occurs in a pharmacy or an online store where one is inundated with choices and becomes confused, often choosing inferior products. Our products can be supplementary to current or future prescription products or in-office procedures. For we believe that providing simple daily products are required no matter what else is prescribed. Next, please. So this is our team, consisting of some of the best scientific and clinical minds in eye care. We are proud to call them our advisors, mentors, and friends. This is a team that makes Mize a truly great experience for patients and doctors. Next, please. So become a Mize Care partner. Sign up is easy and can be done in 5 minutes or less. Go ahead, Lisa. In fact, if you go to the sponsorship area in the virtual exhibit hall, we will offer a $50 Starbucks gift card to the first doctor that signs up starting now. Otherwise, the sign-up sheet can be found at the URL shown here or under the Eye Care Professionals heading on the website, helpmize.com. Next, please. We then contact you to set up your personalized storefront and tear sheets and immediately provide your dedicated QR code so you can begin using the platform immediately. If needed, myself and our lead technician will be happy to do a conference to help you with using the platform in your offices. Then begin using the platform. It's simple. No need to continue to hand out samples and coupons and get nothing in return. Gain important retained revenue while providing your patients with some of the best and safest products on the market. Next, please. So Mize believes that this leads to happy doctors and patients alike. Don't forget to follow us on Instagram and LinkedIn at Help Mize. Seize the daily care for eyes. We are Mize. Thank you very much for your time. I hope you enjoy the rest of the conference. I think we have a few minutes for some questions. Dr. Durker.
Yeah, great presentation. Really appreciate the information, learn some things, and I think this is a great concept. We have some questions in the chat. Question is, can somebody outside of the US access the Mize platform?
Yeah, so currently we're only in the US. We don't have the ability to ship currently to outside of the United States. We can ship over to Hawaii or to Alaska. It's just at a higher rate.
And then there's a question that maybe got answered in the chat, but we can expand on, is you've got a lot of products now and you're building these different packages. And there was a question is, are you going to have more products in the future? Are you going to be able to do other disease states other than dry eye and ocular surface disease?
Yes, there certainly are many things in the pipeline. We're looking at having a beauty routine with eye healthy makeups. That is something we really want to do. And as I mentioned, we're going to be rolling out a specific allergy routine, a specific Demodex routine. So in the coming days and weeks, you'll see the site change a little bit because we will be having many more routines. But yes, that is all coming down the line. We have just added a few new products. One of them is the Hydro Eye ocular supplement for dry eye. And so, you'll see some new products on the site. Actually, if you go to the site now, I think those are available.
We had a question about how does your platform differ from others that may provide OTC products to patients that you recommend in the office? What are the main things that make Mize unique?
You want to take that one, Lisa?
So the main thing that makes Mize unique is we have continuing support for our patients. So we're going to be sending them reminders. I'm really, really excited about the app that's in development right now, because that's going to be able to help them track their treatment plan to see, what they're actually doing. It's going to give them reminders about how their eyes are feeling. It's going to, tell them, hey, maybe you forgot to do your artificial tears today. So it's something that it's not just, here's your products and we'll see you in a couple of months. This is something that we're going to keep supporting them every single day. And we're also going to have a huge educational component to the app. So there's going to be videos on there. So they're going to be able to learn more about dry eye disease as well.
I think the other thing that separates us from some of the competition is that we put together these routines, right? So in a routine, you have more than one product. So in a simple blepharitis routine, you may get a lid wipe and an eye drop. But for someone with more severe meibomian gland disease, they require something a little bit more. So they'll get a meibomian gland specific eye drop. They'll get a lid wipe and maybe an eye ointment that can help them overnight that has some vitamin A in it. So we put these together in a package, which makes it very easy for the patient. They just have to click on one thing. They don't have to source 3 or 4 different products in order to get the package that they want.
Well, great. A lot of exciting things there. I think patient engagement, and our good friend Doug DeVries always says, the dry eye journey for a patient is a marathon and not a sprint. And you need a lot of people along that marathon providing support for the patient. So you can see in the box underneath the video screen, register now for Mize to become a Mize Care partner today. It's been a great session. Dr. Hornick, Dr. Farris, thank you so much for joining me at Eyes on Dry Eye 2023 and for letting us know all the things that are happening over at Mize.
Thank you. It was great. Thank you so much.